Congratulations on starting your Invisalign journey today. Invisalign is orthodontic treatment that allows us to move the teeth and align them in the right position without the hassle of metal brackets or wires. A good candidate for Invisalign is anyone who needs orthodontic treatment. If your bite is misaligned, if you have spaces, if you have crowded teeth, you are all good candidates for Invisalign. Today I'm going to give you some instructions on how to use your Invisalign trays when you are at home. My assistant should have gone over with you on how to take in and out these trays by yourself. You are given a few tools today with your Invisalign trays. The first tool is this hook. It's called pull tool, and it helps you remove the trays easily. So you use this hook to get under the tray and pull it up, and once it's out, then you use your fingers to remove it. Make sure you have practiced putting in and out your trays in the office with my assistant. The second tool is this munchie. Now this munchie has to be used 15 minutes twice daily, every single day. So the notch, which is wider, is meant for the upper front teeth. Insert it in the upper front teeth and then you chew on it. This has to be done with the trays on so the trays can seat better. This is also an exercise that is done to make sure that the treatment stays on track. The smaller notch is for the bottom teeth, and you can insert on the bottom teeth and then chew on it. And the wheel is meant for the back teeth, and you put it on the back teeth again with the trays on and chew on it. Now this exercise must be done 15 minutes every single day, twice daily. When you practice with this in the office, make sure the assistant shows to you how this upper notch fits in your trays and how you are supposed to munch on it or chew on it. This helps you keep your trays in the place and keeps your treatment in track. You must wear your trays 22.5 to 23 hours a day. This is very important. That means you only have 1 to 1.5 hours during the day to eat your meals and brush your teeth. If it is uncomfortable for you to eat with the trays on, you can remove the trays and eat your meals. Just understand that your meals have to be short and you must put your trays back on immediately after finishing the meals as soon as you have brushed and cleaned your teeth. You have been given a series of trays. Remember to save the previous tray as you progress into a new tray. This is really important in case of emergency such as you lost your current tray. Then you can go back to the saved previous tray and the treatment stays on track until we are able to order a new tray for you. Please pay attention to your attachments daily while brushing your teeth. In case you lose an attachment, do call the office immediately so we can bring you in and replace your attachment. Your Invisalign trays come with a box. Let's explore the box. When you open the box, there is a barcode. You can download an app called My Invisalign app and scan this barcode. That will take your information and then you can track when to change your trays. The next thing in the box is a container. This is really important and valuable as you can store your trays in the container. It also helps you keeping the trays in the container so they don't get lost or you accidentally throw them. The third thing in the box is the cleaning crystals. These are sachets of cleaning crystals that are meant to put in the water and make a solution. The trays can be dropped in the solution to be cleaned out. Remember, this is only when you are brushing and flossing your teeth. This is not an overnight soak. The trays have to be on your teeth for them to work. So The only time you could be cleaning your trays is when you brush and floss your teeth. Remember, your teeth are moving. You will have some discomfort in the beginning. Usually the discomfort lasts from 1 to 3 days, and then your teeth ease into the trays. During that discomfort, try to take something as Tylenol and not ibuprofen or Motrin. Tylenol is the only thing that's recommended while you're doing orthodontic treatment. If you have any questions, don't hesitate to call the office or ask my assistant or myself, and I'll be happy to go over with you.